Shash Case-Based MCQs, DRAP Ham Guidelines 2022. Shash Q1, double checking requirement. A nurse prepares an IV dose of potassium chloride concentrate for administration in ICU. What is the safest next step before giving the drug? A. Administer immediately if confident. B. Ask another healthcare professional to independently verify the preparation. C. Dilute further without checking. D. Record only and proceed. Answer B. Ask another healthcare professional to independently verify the preparation. Explanation. All hams must be counter-checked by a second independent healthcare professional before dispensing and administration to prevent fatal errors. Q2. LASA confusion prevention. In a ward, dopamine and dobutamine vials are kept together on the same shelf. What should be done to minimize risk? A. Keep them together, since they're both inotropes. B. Use tall man lettering. Dopamine versus dopamine, and store separately. C. Use brand names only. D. Allow nurses to differentiate during administration. Answer B. Use tall man lettering, dopamine versus diobutamine, and store separately. Explanation. LASA, look-alike, sound-alike hams should be clearly labeled using tall man lettering and stored apart to avoid mix-ups. Hack scribing privileges. A junior resident writes an order for chemotherapy IV doxorubicin in the ward. According to DRAP ham guidelines, is this acceptable? A. Yes, anyone can prescribe. B. Yes. If pharmacist verifies, C. No, only oncologists, hematologists with privileges can prescribe. Yes, if nurse double checks, answer. C. No, only oncologists, hematologists with privileges can prescribe. Explanation. Prescribing rights for certain hams, e.g. chemotherapy, thrombolytics, are restricted to specialists with approved privileges. Q4. Unhigh risk. A syringe containing clear fluid is found in a patient's room without any label. What should be done? A. Administer if it looks like saline. B. Send for lab analysis. C. Discard immediately as per SOP. D. Keep for future verification. Answer. C. Discard immediately as per SOP. Explanation. Unlabeled syringes infusions must never be used. They are a major source of wrong drug errors and must be discarded immediately. Storage Q5. State a pharmacy inspection, insulin vials are found mixed with antibiotics in the same bin. What is the correct practice? A. Allow mixed storage since both need refrigeration. B. Store separately with clear labeling as high alert. C. Place them according to alphabetical order. D. Keep them in nurses' trolleys for easy access. Answer. B. Store separately with clear labeling as high alert. Explanation. Hams like insulin must be stored separately in labeled containers, not mixed with other medicines. Hashed Q6. Error reporting culture gives IV magnesium sulfate without dilution, but the patient is unharmed. She hesitates to report fearing punishment. What is the recommended approach? A. Ignore since no harm occurred. B. Report as a near miss in a non-punitive culture. C. Report only if patient harm. D. Report secretly to pharmacy only. Answer B. Report as a near miss in a non-punitive culture. Explanation. The guidelines promote open, non-punitive error reporting to identify risks and prevent recurrence. Harsher Q7. Safe administration practice. A U to give oral chloral hydrate for sedation through a syringe connected to an IV line by mistake. Which principle prevents this? A. 6 rights of drug administration. B. Same route preparation. C. Avoiding verbal orders. D. Prescriber's privilege restrictions. Answer A. 6 rights of drug administration. Explanation. Following the right patient, right drug, right dose, right time, right route, right documentation prevents wrong route administration. Q8. Procurement of ham. A hospital plans to per brand of enoxaparin every month due to supplier changes. What risk does this pose, and what is the recommendation? A. No risk if generic is same. B. Confusion due to frequent brand changes. Avoid frequent switches and notify staff. C. Safer since multiple sources available. D. Recommended for cost saving. Answer B. Confusion due to frequent brand changes. Avoid frequent switches and notify staff. Explanation. Frequent brand strength changes in hams increase error risk. DRAP advises avoiding such changes or notifying staff if unavoidable. Q9. Patient education. A patient discharged on warfarin is owed I know about my medicine. The most important teaching points: A. Store in fridge. B. Monitor INR and avoid interacting foods drugs. C. Take extra dose if one is missed. D. Stop when symptoms improve. Answer B. Monitor INR and avoid interacting foods drugs. Explanation. Patient education on hams must include lab monitoring, drug-food interactions, emergency precautions, and adherence. Q10. Ham in crash carts. Epinephrine is required in ER